Hi, and welcome to episode 330 of the Untethered Podcast. Today we have Tricia Rogers joining us. Tricia is a ASHA certified speech language pathologist, and she has been for 3 decades with over 20 years of specialized experience in orofacial myofunctional disorders. In addition to running a private practice, mentoring, presenting, and professionally consulting, she is a creator and author of Miss Tongue and Friends, a children's book series that makes myofunctional concepts understandable, engaging, and interactive. Written specifically for children, these books are valuable tools for myotherapists, educators, and parents, and can also be shared by healthcare professionals such as ENTs, airway-focused dentists, orthos, and pediatricians to help educate families and serve as a resource for supporting nasal breathing, proper oral rest posture, and healthy oral function. Through Miss Tongue and Friends, Tricia's goal is to help countless children build lifelong habits for healthy oral development, one breath, one book, one child at a time. Welcome to the Untethered Podcast. I am your host, Hallie Vulcan. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and or medical treatment of a qualified healthcare provider. Tricia, welcome to the podcast.
Thank you so much for having me, Hallie. I'm so excited to be here.
I'm excited for you to be here. I know we were just chatting a little bit before we hit record, and it's fun. You were saying it's fun to talk to another author of a children's book. And so I recently discovered your books. Obviously, mine were just recently launched into the world. And so I would love for you to, obviously, we're going to talk about all about the books today, but what brought this idea forward? Why did you create your books? And we'll talk about what they are and everything, but was there some catalyst, something that happened that you were just like, these need to be in the world?
Oh, yes. So I have been practicing myofunctional therapy for 20 years. So I have been in the trenches of myo work for that long, and as a speech pathologist too. So working with little kids was my love. I love working with them. And that was in the beginning too, mostly what kids I was focusing on. So you have to be really creative and you have to have really interesting visuals and keep their attention. And I'd always wanted to write a book. Just don't know why. I always had wanted to. So the combination of that and my experience with the patients carry over at home and trying to get the kids to understand, why do we need to do these tongue movements? Why? And that's truly where it came to, and I used them in my practice before I printed them and published them in January. So
I love that.
My clients have been the field testing and the evidence-based for the books. Yeah.
I love that. I love that because when we did ours, we had our moms read it and our kids read it. and we were like, do they make sense?
Right.
As long as it makes sense.
Yes.
It doesn't have to be perfect, but does it make sense? They're like, it makes sense. We're like, okay.
What are you getting from this? Tell me what you get from, yes.
Exactly.
Yeah.
I love that. Yeah. It's so funny because I know we were talking about the timeline a little bit, and I think you said you started yours in 2020.
Mm-hmm. Mm-hmm.
Yeah. I think we were right around there, maybe 2019, but my friend Jen, who I wrote the books with, she was pregnant with her son who's about to turn 5. So if that tells you anything, It was just this, it's a labor of love, especially we were doing it together. We kept meeting to write, and then it was one book to start. Then we separated it into 3 because we were like, well, one's about, tongue tie, and one's about myo, and one's about tongue tie release. And maybe families don't want to talk about one of those things necessarily yet. So we didn't want to force it on anybody. Mm-hmm. So let's separate the concepts out, which ended up working really nicely. But now we're already having these other ideas of we could do a book on this and we could do a book on that. And we're like, oh my goodness, how long will these take? Because 5 years later.
Exactly. Oh,
you get it?
I totally get it. I know. So my books that are now 3 in a series, and then the one a supplement. Just like you, I have these other ideas that are literally in the works. I just have to get the illustrations done, right?
Yeah, love it.
But it was like Miss Tongue is what learns to rest is one of them. It started out as Mr. Tongue from the concept of the therapy session where the idea popped into my head, and it was going to be, then it turned to Miss Tongue, and then it was going to be one book. And I was like, but it can't. It just can't, because you can't just talk about the tongue and not talk about the lips and the nasal breathing. So then that put me back in the time frame too, because I had to come up with the text and the illustrations of it. And then now it's a series. You can buy them separately, but like you have to talk about all of it.
Yeah. Yeah. No, absolutely. Yeah. So I love that.
Yeah.
So, okay. So Miss Tongue and Friends, right? So you've got these books. Yeah. Who are the friends? Is it the lips? Is it tell us more about that?
Yes. Okay. So I left it really, so the tongue, as we know, is extremely important. But she can't do all of her work well without the help of the other parts of the body. So the friends right now, there is the Mr. Nose, who has secret superpowers to learn how to breathe, and the lips, which is top lip and bottom lip, that learn to stay together. So like the book is the lips learn to stay together, Mr. Nose learns how to breathe, and where's the other one? And there it goes. Miss Tongue learns to rest.
I love it.
So yes. So and there is another friend that's in the works, and his name is Airy the Airway.
Oh, yeah. I was like, are we going with the jaw? Are we going, hey, the air?
Yes.
Not yet. But wait.
Actually, the jaw is in the process too. It's, these books are like age, like young to like 6, 7, 8. And I'm creating a version for the school age that has the jaw and the lips are in that book together there's the nose and then the mouth. So that's coming kind of in an SLP kit that's going to be out in the near future. But anyway, yes. But that's where I pull in the jaw. And in the lips book, I talk about the mouth and how the lips even need to stay together when the teeth are chewing. So I just kind of put a little bit out there about they have to stay together even when the teeth are chewing, to kind of introduce that lips together during chewing.
I love that.
Yes.
I love that. I feel like these feel very like therapeutic, but in a very friendly way.
Yes. That was my point.
I love it.
So the concepts in a fun and friendly way. Simple concepts, for the kids.
So, I mean, I can see like other SLPs using these in therapy, SLP, OT, anybody working on feeding, anybody working on myo, right?
Yes.
RDHs, even if they're working on the myo skills. So who else do you feel like these are for besides the obvious, professionals?
So the parents. Parents that it's a great way. I have had some dentists and orthodontists have them in their practice, and then they're there to be the parents will read it. And then they've already kind of prepared them for when the pediatric dentist is going to come in and talk about mouth breathing or why so it's like a kind of foundation. One of my colleagues, the books were in the waiting room. The parents were reading them. 3-year-old comes in and she's like, Tricia, you made my life easy explaining to why it was necessary to do treatment and start treatment with this little one because of that. So that love to get pediatricians on board, love to get the ENTs on board. Yes. So it's literally anyone, teachers, school nurse. I actually had a trauma therapist that works with kids order my books. And the trigger to me was like that. Okay, breathing, how important breathing is for your central
I'm getting
nervous system.
chills. You just said that and I got like chills because I was like, I didn't even think about that, but you're so right.
Yes.
Like how important is breathing to our nervous system.
Yes.
And obviously if we can't breathe, the trauma that we've been to, there's just, it's all connected to healing. Yeah.
I was so over the moon when that one came through too, because it's like, I recognize that that as a myofunctional therapist, I can see how that's where it can be used. And it really helped the parents with the kids and the carryover at home. It's fun rather than a nag. But that trauma-enforced therapist or trauma-centric therapist just made my heart sing. It did. Yeah. As does everyone, but yeah.
Yeah. No, but it's really cool though to like experience these other avenues that maybe are not our traditional, our brain's like, okay, SLPs and OTs and maybe even PTs and the doctors and the ENTs and the dentists and the RDHs, like everybody's like immediately connected to this myo, even pediatric feeding airway, spaces, but then and tongue tie and all the things. But then you're like, oh, there's other people who can totally benefit from this. And how cool to open up that conversation. Like, let's say these are sitting on a table in a pediatrician's office and a parent picks them up. One of our goals was just to normalize the conversation, to understand like, oh no, my tongue is stuck. Like I can't move my tongue. Well, why? Let's talk. Maybe we go talk to our dentist, right? Or, oh no, my mouth is open and we got to breathe through our nose and close our lips and keep our tongue up and bring our, teeth together. And so, it was like, if we can just have like this fun, lighthearted story and conversation around these very otherwise stressful topics for parents and even some professionals, we can just like make it a little bit easier to have the conversation.
100%. Yes.
I love that. I love that. And then there's also like all the body workers too, right?
Yes.
All of those individuals who help with the fascia, right? I mean, there's just so many different people I feel like that probably benefit from having these in their arsenal of tools and on the coffee tables in their waiting rooms. And
absolutely. In fact, I've been talking with two recently, one that I would do referrals with and another one in my hometown in South Carolina. And she's like, oh my gosh, tell me more. She works with infants. And so we talked a lot about the tongue ties and then the resting posture of the tongue. And, I told her about my other one, Miss Tongue Learns to Dance, which is like the tongue is stuck one. And so I told her about that and she immediately, she ordered them. She's like, I'm going to have these just as a topic of conversation and just more knowledge that anyone can have to make people understand mouth breathing that's not what we want people to be doing. It's not optimal. It's not desirable. And how can you notice it and see it and what can you do?
Yeah. Yeah. And I love how you mentioned like that the nose, breathing through your nose is a superpower because we kind of went with a superhero theme too. And it was like, I was like, how cool. And I think what sparked that for us is when we were thinking about the tongue tie release story, we were talking about like the magic wand or the, it's kind of like we just started to think in superhero mode and we were like, and it's a little girl in our story and people don't always associate little girls as superheroes, right? It's always the boys. So we made it an all female book series for ours. So when you were like Miss Tongue, I was like, yes, Miss Tongue.
I know. It's like, yes,
full power.
Exactly. So she is the main, right. Yeah. It was a friend of mine that we were looking at the book because and she's not in speech or myo or anything. And after she goes, I think the tongue needs to be a female. And I was like, you're right. And so I had the illustrator to add the eyelashes and go up. That's how, that came. But it's true. It's like Miss Tongue and Friends. And there's so, as you know, and what the ideas, I am so open to ideas from everywhere and anywhere, parents, other therapists. And in fact, sidebar, I want to do a feeding one.
Oh,
it is in because, and just like challenges and, just like talk about the challenges of eating. And so, you and I need to talk about this because I want to get that right in the concept of talking to the children. So anyway, so sidebar, but I love that we all are doing these books and we all are talking about them and getting these concepts in a fun way. And the superhero is the best. just love that.
I mean, I invite more people to like write more kids stories about these topics, because if we could have a little library, like a shelf in the library, right? A shelf at Barnes and Noble, a shelf on Amazon, like where people actually Google it and they actually have to choose because there's so many of them. Like, then I feel like we've accomplished something here, right? It's like, you know, a lot of people are like, oh my gosh, well, you don't want competition. No, I do. Not even, I'm like, these books were not created to make money. These books were created to educate. And the more education that we can put out there, the more we normalize the conversation, the more people will start to recognize, and parents and children will start to recognize, you know, oh, I should be breathing through my nose. Oh, my tongue should be up. And it's funny because like the more parents, I created this podcast for professionals, and I have so many parents who listen to the podcast, who use the information, who are so like well educated to the point of being able to go have a conversation with a provider now. And they know what to ask for, and they know who to look for. And they, you know, if they can't find them, they'll message me on Instagram and they'll be like, do you know somebody here that does X, you know? And I'm like, that's power. Like knowledge is power. And I didn't have this information. So think about like us being in the field without all the info, right?
Right. I mean, and yes, I'm trying to, like you, I'm thinking of this like as a tool and a gift to anyone that is working with children, and the struggle of them, you know, the therapists that have to deal, the parents that have to like try to get their child to do something that's so important for their overall health. And yes, like I totally agree with you. It's like, it's such, the more, the better, the library of them. Absolutely. I'm so excited. Makes me happy.
I love it. So, okay. So before we go into talking more about like any of the medical stuff, so talk a little bit about the trials and tribulations of writing a book. And like, I know we mentioned timeline, but like just share for everybody, because I know that you and I know, but just so everyone else understands what it is to birth a book.
It is
for a series of books.
Exactly what you said. You are I have not birthed children before. I literally kept thinking I am birthing this series, these books. And like we said before, it is a labor of love. And it truly is a labor of love. It took, so I found, you have like your timeline story, the illustrator for my books. I found her on Instagram. She was in grad school when she started drawing the books, and like starting grad school. Okay. So OMDs were very new and different and not like exactly what she knew enough about. Right. And so I had her draw these pictures, and we were doing this. By the time I published them in January this year, she has her C's, right? So she was in grad school. She was a CFY. And I was like, by the rate that I'm going with this, she's going to have her C's by the time it's time to print and, you know, illustrated by. And the beauty of it is like she now appreciates them. She has them, and she appreciates the concepts because she understands it even more. And she had a head start. But part of it for me was the technology of communicating with her in a way that I could, and the times that I kept changing the text. And so I'd change the text, and then the illustrations would have to get changed too. And I thought about the process. It's like, as a therapist, you can correct yourself in the moment if no one's understanding. And as a speaker and presenter, as I do as well, you can correct it if you get a question or somebody doesn't. When you write a book, you've got one chance. One chance to get it right and get it out there and get the point across, especially in my case, where it's an interactive book. So you read the book, and it talks about Miss Tongue, and she's tired because she does all the things like talking and eating and swallowing, and she needs to rest. And in the middle of the book, the children have a chance for their super challenge. And then they try to get their Miss Tongue or their Mr. Nose. And so the phrasing of that to hit the children that are young, but also up to like the 7+ maybe 8-year-olds, although some 10-year-olds have really enjoyed it. It's just, you pick every word apart.
Yes. Yeah.
But it was so worth it. But yes, 5 years.
Yeah. 5 years. Well, and it's, you know, writing it with like my co-author, we write, like we speak differently, we write differently. And so it's like, even just like, and also the way we talk doesn't communicate the same way in written form. So it's like, okay, this sounds good when you and I are saying it, but let's imagine somebody else reading it. Right. Is it going to read that way? Like, let me have my child read it and see how she reads this. Does it flow? Does it make sense? Okay, now let me have my mom read it. She was an editor. Like, do you like this? Does it work? So it's like having all, like you said, you tested it on your clients, like made sure that it worked. It made sense. There's like such a labor of love that goes into it. And then once we actually had it written, we sent it off to an illustrator. He did a great job, except for we were like, her boobs are a little too pointy and there's a little too much cleavage. And this is not, I'm like, this is a kid's series. Like, could you please like take the shirt up and could you put her in pajamas and could you do, right? It was like all these like funny things that we never thought to ask for because it was the first time we'd ever done something like this. So we didn't even know how to properly instruct the illustrator. So, but it would just take like months and months to get the illustrations back. And finally we got so frustrated after like a third round of like revisions that we went and found a whole new illustrator. And that guy was great and everything. But, finally it got done. We wanted some changes to the cover, which I think actually happened. We redid the covers a little bit with, we ended up hiring the company to basically help us bring it forward. So like we're self-published, but the company helped us like get it printed, get it to the printing point. Right. Yes. And then guided someone on my other business team to basically put them on Amazon. And I'm like, great. All the steps, all the whole, like, procedure and processes of getting this to the market was wild.
it is completely mind boggling. And I sometimes I look at it, I was like, I can't even believe that I actually accomplished this in the self-publishing way, like that you did. It's like, how did this happen? But like, I think too, it was like this force that it's like, I knew in my gut, in my clinical gut, in my just being that this concept in this way and in any kind of ways needed to be out there. And it was just, that just pulled me and kept me going when I was pulling my hair out because I was like, I don't even know, what to do next. And so
it's bigger than you, right? It's sort of like this mission, this vision that's like so much bigger than you are. Like that's what happened in my online business when I was starting out. It was like, I want to get kids off feeding waiting lists. Like that was my big goal. And I was like, in order to do that, I have to get thousands of therapists to take this feeding course to help them step into being the feeding therapist they want to be. And then the same thing happened with Myo. And, and I was kind of like, just so driven by this like bigger force, this bigger goal, this bigger mission. I was like, I'm just the person to carry this out. Like I'm just the vehicle, right? To kind of bring this to be. And so it's been very cool because I'm like with the books, it was like the same thing. It was like you're saying, like, I just knew that we needed to bring this forward and that we needed to start. Like, I was like, even if it started a trend, even if that meant other people did this behind us, like somebody's got to start. So that, so I love that, like you and I, it's so funny, like how parallel this was. That, like we were literally both doing this at the same time. We launched them around the same, like you launched yours in January. We just launched ours like a month ago. Yeah. I mean, so funny and also so crazy that we were on like very similar timelines. Like,
it's that amazing. And it also validates what we're saying about like how much effort and love and dedication goes. And just like you were saying, it's like I would be on it and then some life event would happen and then it would take me off for 6 months and then I would get back to it. And I know you had that too. And that shows that it is this bigger force. And I call my mission like one breath, one book, one child at a time.
Yeah.
And it's like, that's my thing. And that's what keeps me going because like you, like everything that you've done and everything that we're all doing, especially when you go from being a direct care therapist to like branching out and helping more than you can one-on-one. It's an amazing thing. And then to be a therapist like you are and I am, it's like, you need this in your practice because let me tell you, I've been there. I know. Yours, mine, you need these in your practice and everyone will be, it's more fun and more engaging than what I.
Well, when you get the kids too, that sometimes are just like in a silly mood or they don't want to participate, but the parents like, we're going, we're here. If we can like offer something else where it's like, hey, you want to just read this for a minute while you take a break?
Right. Exactly. Let's throw it out there. And then it's like, and I've got these props like, here we go. Here are the lips. We're going to go with Ms. Lips today. In fact, I want to tell you a story that happened with that you will just absolutely love. But Yeah, it's just like if they're there, and it doesn't matter how many times. In fact, the more times you pick the books up with the kids, the more the visual and the repetition, and then it could be carryover talk at home. Just like when the whole thing with Miss Tongue started, Mr. Tongue at the time, it was a 3-year-old, and I was like very bright 3-year-old. We had lots going on speech, and I was like, there's Myo going on, and we're going to go there. And the mom was a nurse. I'm like, we're going. And so they kept talking all the week long about Miss Tongue putting her head on the pillow. And that's because in my book, it talks about Miss Tongue, and she rests on the soft, bumpy pillow, which is the incisive papilla, right? It just like popped into my head in the therapy session. And so the mom was texting me, oh my gosh, the pillow. This is amazing. This is amazing. We talk about the tongue resting on the pillow. So
I love it. Yeah. I love it. It's, it's like when you connect and you have those like little ones who like make it all just kind of, it's like the ideas come from them. They just, or your idea comes from working with that patient. I feel like those are the ideas that take off and that like really connect with the other kids.
Yep.
You know what I mean? It's like, thank you, little 3-year-old, for that one session.
That one chaos session when I was like, I am just not making a difference here. And I am not, what is happening?
It's like something finally connected.
Right. Exactly. Yeah.
That's amazing. So, okay. So you mentioned, just to talk a little bit about you too, because you mentioned you're an SLP, obviously. You've been doing Myo, do you say for 20 years?
Yes.
Okay. So you've been doing Myo. Like, how did you enter the Myo space? Tell us a little bit about, because the landscape has changed.
It has changed immensely.
Yes.
So I was in the early 2000s, I took a course from the IAOM from someone, her name was Joanne Smith Peter. So she lived in the Portland area, and she was she's 86 now. Okay. So she's been around in the IAOM for a while. She was, afterwards, she started mentoring me up at the dental school. I would go with her, and she wrote a study about the orthodontia and OMD work. It wasn't called OMD. It was called, at the time, and how it stops relapses from happening. And one of the things that they found in that study was that 80% of the children who started with speech sound disorders after doing the rest posture and that work, the Myo work, they didn't need speech therapy. So I was like, okay. So anyway, so I started with her, and then I took courses with the AMOT, because that started while I was going through the certification process. And so I just decided to get training from both of the entities. And so I did that. I took any course. There weren't a lot of courses out there for a while, but just studied with some of the people, the pioneers that were taught by the people in the 70s when the whole thing started. So it's like, I feel so blessed. And what I say was, I was doing Myo when Myo was not cool. Like, it was not cool. And I constantly was calling up Asha, and I was like, okay, how do I code this? What do I do? And honest to goodness, I then started to just do private pay so that I could do and get, super bills and things like that, because I was like, I am wasting time and energy that is not necessary for my patients and and the parents and the families. And I had the ability to do that in my area. So that's what I went to. And I did that for another 10 years, just private pay. And all I did was speech and Myo. And prior to that, I did oral motor and worked with children with apraxia. So it was always, my interest was in the motor and sensory pieces that were helping or detracting from communicating with the little ones. And, and the jaw was just fascinating to me. Like, when there wasn't a lot of talk about the jaw, I was just completely fascinated by that. So, and the importance of that. So yeah, it's been the minute that I took all of my language materials and tests out of my practice, like I had them in there for 5 years and still didn't move them. The moment that I took that out, I was like, okay, I am a myofunctional therapists, practicing SLP therapists, so it's great. So I absolutely love it. And, as you know, you can't unsee what you see now that you know.
Yeah.
Yep.
Absolutely. Those myo eyes,
Yeah.
once they go on,
Exactly.
you're out of luck. They're not coming off.
Right.
Yeah.
Yep.
I had, so there was an SLP who was working with like older children and adults, and my private practice was all like younger children, infant to really birth to 5, but we were seeing some kids that were kind of tracking with us a little bit older after, because they started with us younger. Anyway, so she and I were meeting one day, and she just come back from a course, and she was like, this is so interesting. And like months later, we're talking again, and she's like, my practice has completely changed. And she was like, I'm not even doing myo in the way that it was completely taught. I'm using it as a tool in my toolbox. But now that I'm seeing things through a different lens, I'm approaching speech sound disorders and, some of these therapeutic interventions differently.
Yes.
She's like, the kids are all graduating faster. They're all making faster. And I was like, hold up. Hold on. Okay. I have a private practice. These families would love to graduate their kids a little faster.
Right.
Tell me more.
Yes.
Within the day, I went and signed up for my course, and I went and I got certified and all the things. And it was absolutely eye-opening.
Right.
And that study that you mentioned, that's exactly what I saw with my patients. All these kids, I used to work with a lot of kids that had the speech sound disorders, severe speech sound disorders too, right? And I had a kid who came to me. It was like one of my most favorite stories. So he was going into high school, and the mom was like, at this point, I started working with like teens and adults because I was like, why not? I knew myo at any age. And honestly, it was like fun to change it up once in a while. And those cases were always a little bit easier. They moved a little faster, So I was like, all right, this is a good little, change things up kind of thing. So this kid, the mom's like, he's going to high school in the fall, and we really want him to be able to speak clearly and say his R's. And I'm like, okay. Meanwhile, this kid has been in speech therapy for like 9 years of his life, and like on and off. And that he had 7 speech therapists. Not one of them ever looked in his mouth or under his tongue. When I pulled out like the little B speech app just to like run through in the eval, just to run through a couple words, I was like, I know this is really juvenile. We're not going to use this in therapy. Yes. I was like, I promise this is just so I can just get a couple quick things just and I will never show you again. And he goes, does every speech pathologist use that? I was like, how many have you had that used it? He was like 5. I was like, okay. I was like, we're going to put that away. I will just make up the words in my head. It'll be fine.
Right.
But no, it was wild. He had this like webbing under his tongue. His tongue was so insanely restricted. Even the oral surgeon was like, I have never seen something like this before. And it was so obvious that had anybody actually ever asked him to elevate his tongue or suction his tongue, you would have right away seen what the problem was. Even if you didn't know what to do with it, you would have seen the problem. So he had, he's probably my only case that age that ever had like a complete like Z-plasty, because he had so much excess tissue under his tongue. It had to be resected. It had to be, it was wild. When I kid you not, like mom ended up hiring like a tutor to work with him in between our sessions just to do drill. Because he was so motivated to like work on the sounds and work on his speech. 6 months in and out. 6 months in and out. And that kid who was scoring below a 2-year-old on the Goldman Fristow, the GFT A3, which we know the gift of 3 is really R heavy, right? So high, we couldn't say any of those.
Right.
He went from being basically a 2-year-old to being like age appropriate in 6 months. And I was like, and it was really funny. He sent me by accident, he sent like a text to me, because he used to send me texts to check in just because they were so highly motivated. I was like, just text me every day and say, homework done, done. I will respond. It's just your check-in. If you have questions, you're absolutely welcome to text me. But he sent me some message that was totally meant for like a girl or somebody that was like his age. And I honestly, I listened to it because I thought it was like, oh, maybe he's checking in. I don't know. That's weird. And I listened to it. I was like, oh, this is informing. I deleted it, and I didn't respond or say anything because that would have completely mortified him more, I'm sure, when he realizes he sent it to the wrong person. But I was like, oh, he sounds so good.
You're as a therapist, you're like, wow, okay, I'm so glad I heard this, because
I was like, and the confidence, because when he started, it's like, he didn't want to speak. He was very timid and shy. And you see these kids, right? Like they gain these skills and all of a sudden they just flourish. And I was like, he is being a freshman boy. And that was the goal.
Thank goodness.
Yes. I'm like, that was the goal. I was like, so happy for him and mom and, but I'm like, had somebody looked under his tongue 10 years prior?
Right. How much?
When she first sought out an SLP because he wasn't speaking clearly and he was already 3, you know what I mean? It's like,
I mean, the suffering that poor kid, I mean, thank goodness it turned into a success story for him because he got to you. But I know that same thing in my practice, same type of thing where they've been to multiple therapists and it's heartbreaking, but that's an amazing story. That's amazing.
I mean, and those are the things that happen when parents are aware.
Yes.
And they have this knowledge, right? And it starts with like tools like this, like the books, and just normalizing the conversation and getting the information out there in an easily digestible way where people go, wait, what? My tongue is supposed to be up?
Right.
Wait, my lips are supposed to be together?
Right.
Like, I don't snore, but like my lips are open. Well, okay, let's talk. You know what I mean? It's just like those little things.
Exactly. It is just, I feel like with you and I, it's so fun to be a part of that knowledge and understanding that people are gathering from our books, from our your podcast, from anything. Like you said, you have parents now listening in on your podcast, not just therapists. And that's the best, because then they're going to tell their mom friends and they're going to tell their mom friends. And speaking of that, like I've been considering and wanting to do, I like to go read my books, right, too. And I have had chances around here to do it. And I want to get into some mom groups because
that's a good idea.
Yeah, I think especially with the books, the characters and how like young you can go with the books. I feel like you could do this in like baby groups because these moms don't have this information. No.
There's probably a handful of them struggling to feed their babies, babies who are fussy and babies who are colicky.
Yes.
And there's actually more going on, and you could be that catalyst to like introduce them to this world of, people who can help.
Yes, exactly. So I'm excited about that when I add that to what I'm doing. The other thing I did one time that was really fun for the little ones, and that where the lips came into be. So there's a child development center that's run by speech pathologists up in Washington State. I live in
cool.
Yeah. So I was going up there to read to the 3-year-olds. Okay. Well, something happened with the schedule, and they were like, well, they had to go somewhere or something, but the toddler group is here. And I was like, all right, so that works for me. I was like, knowing full well that they were not going to be sitting for the entire series of books. It was just 3 at that time, not my Miss Tongue Learns to Dance. But so I was like, had my props like that. And so so a lot of the kids were sitting in the caregivers or the helpers or the teacher's laps and listening to the story. Some were like wiggling somewhere, but this one kiddo. So, Mr. Nose has a construction hat on because he's working, and he's got his super cape, right? Because he's got the secret superpowers. So I had the hats there. And then, so he gets the cape, like the little cape, and he has me put on the cape and he puts a hat on, but then he picks up my lip pillows when we were reading the lip one, and he goes around to every classmate and he put the lips in front of their faces to tell them to close their lips. And this was
I'm getting chills. I love this.
And my husband was recording me, and he was just like, wow. And I mean, I was like, this is amazing.
It landed. The message landed. And he wanted to make sure that everybody else understood it too.
Right. Exactly. So it's like the younger you start reading these books to the children, especially with the great graphics and things like and illustrations, the better.
Yeah. Yes, 100%. I love that.
Yeah.
I love that. And this is what I mean when I say like normalize it. Like just like superheroes fly and save people and help people. Like, well, so does your tongue.
Right. Exactly. Exactly. So
Miss Tongue can do that too.
You can do that too. Exactly. Yeah, that's one of the things I was thinking too in therapy, when like the kids can like co-create their own little Miss Tongue that's in their favorite character, or Miss Tongue that's, part of their superheroes that they like, and take that home that they've drawn or something like that. But but cute. Normalizing, Hallie, I'm going to use that word, normalizing all these simple, but challenging to learn concepts. Yeah.
Right. It's like, how do we make this mainstream? How do we make this like a typical dinner conversation?
Right.
Yeah.
Yes.
Yeah. So you mentioned you're going to do the feeding one, but you're not really like doing feeding therapy. Is that, or you do? Okay. Cause you're just myo speech, right? Like that's your focus.
So this year was going to be my focus on educating myself about feeding. Well, I kind of got a little busy with the release of the books, and I'm also writing another book with an orthodontist like you were talking about, and I'm putting together a course with another colleague. So I'm like, all right, so I feeding is on my list to get more knowledgeable about. But yes, I have a thumb book that's very close to being ready, Mr. Thumb book. And I have the jaw, and I have a few others in the works. Because like you said, there's so many concepts that can be taught with Miss Tongue and her friends, because there's lots of friends that help with the oral function and with airway and breathing. So yeah. So it's exciting. Yep. I just got to take more time to stop and write, right?
I know. And not second guess yourself like 500 times. And do we need to tweak this? And is this going to land? And does this make sense? And,
Right.
and.
Right. And I've also got my books in ebook form now. So
nice.
Yes, they're ebooks, so that it's, easy. People in other countries can buy them this way, which they have. And then it can be like something that the kids can use at home on their iPads.
Yes. Mm-hmm. Yeah, I know you got to meet them where they are. So love that.
Yeah. Yes.
Love that. Or even their Kindles. Some kids have Kindles too, they can get on the Kindle.
Kindles. Yeah. Yes. Love that. Love my Kindle.
Yeah. Amazing. Is there anything that we haven't covered that you want to share about the books? Right. If not, tell us where to find them.
Okay. So you can find them on MissTongueandFriends.com. And then the other one we haven't talked about is my Miss Tongue Learns to Dance. And just like you, Miss Tongue is stuck. Just like your books. And so it talks about interestingly enough for me, this one came out in a rhyme I couldn't write it fast enough. The rhymes about just the basic movements that for tongue range of motion. And it can also be good for differentiation of the jaw and the tongue. So it's got those little movements in there. But MissTongueandFriends.com. I'm on Instagram at Miss Tongue and Friends. And I just have loved talking with you today. And thank you.
This has been so much fun. I am we could talk forever. And I'm so excited to see all these other books that you're going to come out with and add to this series. And everyone knows where to find you now, MissTongueandFriends.com. So go support Tricia, get the books, put them in your library at your clinics. Parents, you need these because they explain a lot of things therapeutically that are much easier to understand in this nice, easily digestible format.
Right.
Yeah. Well, congratulations on the books. I'm so excited for you.
You too, fellow author.
I know, fellow authors. I love that.
Yes.
Thanks so much, Tricia.
Bye. Thank you.
Thanks for listening to this podcast. If you found value in this episode and want to hear more of these MyoTots airway and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBalkin.com or pop over to @HallieBalkin on Instagram to get all the latest updates.